In this chapter, we will be reviewing the examination of all the cranial nerves. It is useful to organize the tests for all of the cranial nerves. Start with those associated with smell, eye movements, and vision together, and then test cranial nerves associated with motor function and sensation of the face. Then those associated with hearing and balance, and finally, test cranial nerves associated with oral mandibular function and swallowing. First, we will consider cranial nerve 1, which is responsible for the sense of smell. The olfactory nerve carries olfactory signals through the bulb and into the temporal lobes where smells are appreciated. Each nostril can be tested separately using an odoriferous substance that can be commonly recognized. Next, let's look at the cranial nerves involved in eye movements and vision. Cranial nerves 2, 3, 4, and 6. Testing the optic nerve, cranial nerve 2, begins by testing the pupillary response in each eye independently and looking for consensual response in the opposite eye. We do this by shining the light first in one pupil and observing for constriction in that pupil, then observing for constriction response in the opposite eye. This indicates the optic nerve and the oculomotor nerve, cranial nerve 3, automatic response is intact. We look at the fundus using an ophthalmoscope to evaluate the retina, vasculature, and optic cup and disc as an indirect measure of intracranial pressure. Swelling in the cup and obscuration of the vessels and disc margins can indicate increased intracranial pressure. Images formed on the retina from the visual fields are transmitted through the optic nerve into the optic chiasm and then along the optic radiations back to the visual cortex where they are interpreted. The oculomotor nerve, cranial nerve 3, powers 4 muscles involved in eye movement: the superior, inferior, and medial rectus muscles, and the inferior oblique, as well as the levator palpebrae, which raises the lids. It also innervates the ciliary ganglion, which contains parasympathetic fibers and constricts the pupil. When there is weakness of the oculomotor nerve and its innervated muscles, the globe appears to gaze laterally. The trochlear nerve innervates the superior oblique muscle, which turns the globe down and in, so damage to cranial nerve 4 prevents this movement. The abducens nerve, cranial nerve 6, powers the lateral rectus, which moves the eye into abduction. Therefore, damage to cranial nerve 6 prevents abduction. 2 nerves, cranial nerve 5 and 7, provide motor and sensory innervation to the face. The trigeminal nerve, cranial nerve 5, provides sensation to the face. The divisions of the trigeminal nerve include the ophthalmic division, maxillary division, and mandibular divisions. Sensation can be tested in each division or region using a cotton swab for light touch and pinprick. The corneal reflex tests the ophthalmic region. At the cheek, one can test the maxillary region, and the mandibular division is tested at the lower jaw. The facial nerve, or cranial nerve 7, controls the muscles of facial expression. The function of this nerve can be tested by asking the patient to smile, close the lids tight, wrinkle the forehead, puff out the cheeks, or other maneuvers. Hearing and balance are the functions of the vestibulocochlear nerve. The vestibulocochlear nerve, cranial nerve 8, carries fibers for hearing as well as balance and vestibular function. Hearing is tested using the finger scratch. If impaired, the whisper test, conducted from a distance, can help roughly differentiate high tone from low tone loss depending upon what you whisper. Hearing input is transmitted to both temporal lobes from each ear. The Weber test can help determine lateralization of hearing, and the Rene test helps differentiate neural hearing loss from conduction abnormalities. These will be further illustrated in a later lesson. Many tests exist to help differentiate vestibular dysfunction and imbalance. On extraocular movement testing, you are looking for nystagmus, which can be horizontal, vertical, or torsional. Additionally, observe forward gaze to determine if there is skew deviation. The Fukuda step test can help to determine which ear mechanism is dysfunctional, with the patient generally turning towards the dysfunctional side. To do the test, the patient is asked to close their eyes and raise their feet, stepping in place a few inches off the ground with each step. The impulse test involves turning the patient's head sharply while asking them to focus on the examiner's nose or eyes. When abnormal, the eyes will deviate in the direction turned, and one will note a corrective saccadic eye movement to refocus on the nose. In the normal case, a patient can keep his eyes on the nose during the head turn. Oral mandibular function and sensation is provided by cranial nerve 9, 10, and 12. Examination of the glossopharyngeal and vagus nerves involves testing the gag reflex and asking the patient to vocalize while looking at the uvula and determining if there is deviation. The gag is elicited by touching the tonsillar pillar lightly with the tongue blade. Gag testing should result in uvula rising in the midline. Unilateral damage of these cranial nerves will result in the uvula being pulled to the side which remains intact, so away from the damaged side. The hypoglossal nerve innervates the muscles of the tongue. Testing of this cranial nerve involves testing tongue strength and observing for deviation when the tongue is protruded. The last nerve to test is cranial nerve 11, the spinal accessory nerve. This nerve is tested by having the patient turn their head into your hand held at the cheek and shrugging the shoulders up against resistance.